So imagine for a second that you're walking into a high-end medical spa, or, maybe it's just your regular gynecology clinic.
Right, with the soothing ambient music and the cucumber water in the lobby.
Exactly, the whole minimalist decor vibe.
Hmm.
And you sit down in this really plush chair, and somebody hands you this thick, glossy menu of services. But you aren't looking at options for a chemical peel or a deep tissue massage.
No, you're looking at something much more intense.
Yeah, you're looking at an extensive menu of what they call intimate rejuvenation procedures.
Hmm.
And you start reading these incredibly slick, futuristic brand names. I mean, we're talking Mona Lisa Touch, Thermeva, Femilift, Empower RF.
They definitely sound like they belong on a spaceship.
Right. And they all make these sweeping promises to, like, turn back the clock on aging tissue, to restore comfort, to tighten things up, to basically rejuvenate. But if you're the patient sitting in that waiting room, staring at this list of super expensive procedures, how are you supposed to know what you're actually buying?
It is a completely overwhelming position for a consumer to be in. I mean, you're presented with this list of trademarks and branding, but underneath those polished names, you've got entirely different scientific technologies.
A completely different physics, right?
Exactly. Varying mechanisms of physics and vastly different patient experiences.
Mm.
The marketing makes them sound totally interchangeable, but the actual medical science tells a completely different story.
Which brings us to the core mission of today's deep dive. We are taking a massive stack of sources, everything from clinic marketing brochures and peer-reviewed medical journals, all the way to some heavily worded regulatory crackdowns from the FDA and the Australian TGA.
It's a lot of material to get through.
It is. But we're going to answer one crucial question for you today. Are these branded rejuvenation procedures actually medically different from one another, or is this whole industry just a triumph of clever marketing?
It's such a fascinating topic because we're looking at a space that sits right at this chaotic intersection of, well, quantum physics, women's health, and global medical regulation.
So to untangle all that chaos, where do we even begin?
Well, to really understand it, we actually have to start as far away from the pelvis as possible. We have to look at the face.
The face. Okay, wait, why the face?
Because the entire foundation of this industry relies on the fundamental physics of aesthetic energy devices.
Mm.
And those devices were originally engineered for facial dermatology.
Right, right. Before these machines were ever marketed for vaginal health, they were basically the go-to tools for erasing acne scars or blending out severe sun damage.
Exactly, or tightening wrinkles on the face. And when we talk about ablative skin resurfacing lasers in this context, there's a pretty massive misconception.
What's that?
Most people assume that a skin laser targets the skin cells themselves, but they actually don't. These lasers are hunting for water.
Okay, that is wild. They're hunting for water.
Yeah, that's the core mechanism driving all of this. I mean, human skin is primarily composed of water. So biomedical engineers design these lasers to emit very specific wavelengths of light.
So it's light that basically ignores everything except water.
Pretty much. There are photons that are highly absorbed by water molecules. So when that targeted laser light hits the tissue, the energy is just instantly absorbed by the intracellular water.
And then what happens?
The water reaches its boiling point in a fraction of a millisecond, and it just vaporizes, taking the surrounding microscopic column of tissue with it.
Oh, wow. I mean, it sounds incredibly violent when you describe it that way. You're essentially like boiling tiny holes into a person's face.
You're intentionally inducing a crisis, because by vaporizing those tiny microchannels, you trigger the body's innate wound healing cascade.
The body basically freaks out and tries to heal itself.
Exactly. The body recognizes the injury, goes into this localized state of panic, and rushes fibroblasts to the area to repair the damage. And in that repair process, the body generates fresh, dense layers of new collagen and elastin.
Okay, and our sources call that process neocollagenesis, right?
Yes, neocollagenesis. It's the biological engine powering every single one of these devices.
But the devices themselves use different fuel, so to speak, because not all lasers are created equal. And I think this is where the medical differences between these major brands really start to reveal themselves.
Right. If you look at the heavy hitters in the ablative laser world, the two main camps are CO2 lasers and erbium YAG lasers.
Okay, let's break down the CO2 laser first. What makes it unique?
So the CO2 laser is the older, incredibly powerful workhorse of the industry. It operates at a specific wavelength of 10,600 nanometers.
Which means what, practically?
Well, at that specific wavelength, the light is strongly absorbed by water, yes, but it also penetrates quite deeply into the dermal layers.
And when it hits that deep tissue, it doesn't just vaporize the water, right? Our sources point out that it leaves a substantial zone of what they call residual thermal damage.
Yeah, that's the medical term for it.
We're talking about a halo of intense heat injury, roughly like 50 to 150 microns wide, completely surrounding that vaporized hole.
And that lingering heat is actually the primary strategy of the CO2 laser. That severe thermal injury causes dramatic and immediate tissue contraction.
So the heat basically cooks the tissue to shrink it.
In a way, yes. The heat denatures the existing collagen proteins, causing them to physically shrink and tighten while simultaneously kicking off that massive long-term collagen production.
So it works really well then.
Oh, it produces phenomenal results for deep, stubborn wrinkles or severe pitted scarring, but the trade-off is brutal.
Yeah, the downtime is no joke.
Yeah.
A patient is looking at a solid 7 to 14 days of significant downtime. We are talking intense redness, swelling, weeping, peeling, just misery.
Complete misery. And you'll see this specific technology powering brands like Pixel CO2 or CO2RE.
You know, I was thinking about how to visualize this, and it kind of reminds me of deep frying something in a kitchen.
Oh, deep frying. Okay. How so?
Yeah, like when you drop food into a deep fryer, the intense boiling oil doesn't just cook the outer layer, right? That residual heat penetrates deeply, and it lingers inside the food, cooking it from within long after you pull it out of the oil.
That's actually a really great analogy.
Thanks. Contrast that with the other major technology, the erbium YA laser, which to me seems far more like taking a kitchen blowtorch to give something a really quick, rapid sear.
The blowtorch analogy captures the physics perfectly because the erbium laser operates at a much shorter wavelength of 2,940 nanometers.
Okay, so a totally different wavelength.
Right. And at that exact wavelength, the light energy is absorbed by water 10 to 15 times more efficiently than the CO2 laser.
Wow, 10 to 15 times. So it hits the water molecules and obliterates them before the heat even has a chance to spread to the surrounding area?
Exactly the point. Because the vaporization happens with such extreme efficiency, it just doesn't leave much collateral heat behind. That zone of residual thermal damage shrinks way down to just 10 to 40 microns.
That is a massive difference.
It is. It's so focused and efficient that dermatologists actually often refer to erbium as a cold laser.
Which is wild for a laser that boils water, but it means you get incredible precision. You get surface-level tissue ablation with almost zero lingering heat, and the healing time drops drastically down to just 2 to 5 days, right?
Yep, much faster recovery.
Yeah.
But because you are missing that deep, sustained thermal shock that the CO2 provides, you naturally get less dramatic structural tightening.
So you are always making a clinical trade-off. Deep, dramatic tightening with a miserable recovery period versus precise, superficial resurfacing with a much easier recovery.
That's the choice, exactly.
But wait, hold on. If these lasers are essentially just blindly hunting for water in the skin, what happens when they hit darker skin tones?
That is a crucial question.
Because human skin isn't just a bag of water, right? It's packed with melanin, and darker objects absorb heat differently. So blasting deeply pigmented skin with intense residual heat sounds like a pretty massive risk.
It is a very real clinical risk. And in dermatology, it's managed using the Fitzpatrick scale, which is basically how they classify skin types from very fair to deeply pigmented.
So how does the CO2 laser perform on the Fitzpatrick scale?
Well, because the CO2 laser generates such a massive halo of collateral heat, it carries a significantly higher risk of triggering hyperpigmentation in patients with richer, darker skin tones.
Hyperpigmentation meaning a permanent darkening of the skin.
Right, permanent or semi-permanent. The melanocytes essentially react to the severe heat trauma by overproducing pigment.
Oh, wow. So what do doctors do?
For those patients, the colder erbium laser is frequently chosen as the safer ablative option because it minimizes that thermal damage zone, which reduces the risk of a pigment response.
Okay, so we have a solid grip on the baseline physics. Photons of light target water, vaporize tissue, induce trauma, and trigger collagen. But eventually, this technology migrated.
It definitely did.
The exact same physical principles used to smooth out a sunburned forehead or erase an acne scar were adapted for a totally different part of the human anatomy.
And that migration spawned a highly lucrative, multi-billion-dollar global industry.
But to understand why these devices moved from the face to the pelvis, we have to look at the stark medical reality of what happens to the genitourinary tract during menopause.
Right. In the medical literature, this is known as GSM, genitourinary syndrome of menopause.
Okay.
It was previously referred to as vulvovaginal atrophy.
And the statistics on this are just staggering. I mean, GSM affects roughly 70% of all postmenopausal women, and we aren't talking about like mild discomfort here.
No, it can be totally debilitating.
The symptoms include severe vaginal dryness, extreme tissue fragility, chronic pain during sex, and cascading urinary issues like stress incontinence.
It's a chronic progressive condition, and it's directly caused by the steep drop in systemic estrogen.
Because the tissue needs estrogen to stay healthy.
Exactly. Without estrogen feeding the tissue, the mucosal lining physically thins out, it loses its elasticity, and it loses its natural lubrication.
But perhaps the most shocking aspect of GSM to me is the treatment gap. Despite 70% of women experiencing this condition, the data shows that only about 7% of them ever receive medical treatment.
It is a massive failure in standard care.
Now, traditionally, the gold standard treatment for this has been hormone replacement therapy, or HRT. You prescribe localized or systemic estrogen, and the tissue regains its thickness.
But that doesn't work for everyone.
Right. What if a patient cannot take hormones? What if she is, say, a breast cancer survivor whose cancer was estrogen receptor positive? Or what if a patient simply refuses hormone therapy due to personal preference?
And that enormous void in treatment options is exactly where these energy-based devices saw an opportunity. They basically emerged as a purely mechanical, non-hormonal alternative.
So just applying the facial laser theory to GSM?
Precisely. The theory was simple. If we cannot use chemical estrogen to thicken the vaginal walls, perhaps we can use the physics of lasers to trigger that same neocollagenesis we see on the face, tricking the mucosal tissue into regenerating its own structural integrity.
But the industry didn't just market this to breast cancer survivors, did they?
Oh no. They cast a much wider net.
They took these genuine medical treatments for a painful, debilitating condition like GSM, and they packaged them under this incredibly vague, catch-all marketing term, vaginal rejuvenation.
Yeah, that term has caused so many problems.
Suddenly, the line between treating a recognized medical pathology and pursuing a cosmetic designer vaginoplasty became completely blurred.
It's a marketing term that has done incredible damage, really. It created immense confusion for the consumer, who suddenly couldn't distinguish between a spa treatment and a medical intervention. And frankly, it triggered intense frustration among health regulators. I can imagine. But strictly from a biological standpoint, I have to wonder about the logic here. I mean, the industry basically took a facial laser, slapped a different shaped probe on it, and moved it down south. Is the tissue of the face and the tissue of the vagina even remotely comparable enough for that to make sense?
Well, the gross anatomical structures are undoubtedly different. I mean, the vaginal mucosa is a non-keratinized, stratified squamous epithelium.
Say that 10 times fast.
Right. But basically, it is not the same as the keratinized epidermis of your face.
Okay, so they are different.
They are. But the underlying cellular machinery, the biological target, is identical. Whether you are firing energy into a cheek or a vaginal wall, you are inducing a controlled thermal injury to stimulate fibroblasts.
The body's repair cells.
Exactly. The fibroblasts do not care where they're located. When they're stimulated by heat, their job is to produce fresh collagen and elastin fibers, which increases local blood flow and thickens the tissue. Okay, which perfectly sets the stage for the great technology war. Because the demand for these non-hormonal treatments absolutely exploded, and clinics rushed to buy these devices.
And this is where it gets really confusing for the patient.
Right. If you're a patient looking at that menu of brand names we discussed in the beginning, this is the exact moment where the procedures actually differ medically. The industry fractured into two completely distinct scientific camps: light versus electricity.
Yes. So on one side of the aisle, you have the laser camp. This includes prominent brands like the Mona Lisa Touch, which utilizes CO2 technology, and the FemiLift, which can use CO2 or erbium depending on the specific model.
So these machines rely entirely on the light-targeting water physics we broke down earlier. They are ablative. They physically destroy microchannels of tissue inside the vaginal canal.
Which means they cause real trauma.
Right. Because you are literally vaporizing tissue, patients often need a topical numbing cream beforehand, and they are looking at a few days of required downtime and pelvic rest while the mucosal tissue scabs over and heals.
It's definitely an invasive feeling procedure.
It's basically the medical equivalent of aerating a lawn, you know? You're punching physical holes into the earth to force the roots to stimulate fresh, dense growth.
That's a perfect way to picture it. But on the other side of the aisle, you have the radio frequency, or RF, camp.
Okay, the electricity camp.
Right. This includes massive brands like Thermiva, Empower RF, and Vivev. RF technology is fundamentally alien compared to a laser. It does not use light photons, it doesn't target water, and it does not destroy or ablate the tissue surface.
Wait, if it isn't vaporizing water, how is it creating the heat needed for collagen production?
Radiofrequency uses high-frequency electromagnetic currents. The device passes this electrical current directly through the tissue.
It's just sending an electrical current right through.
Yeah. And as the current oscillates, it causes what is known as ionic agitation.
Ionic agitation, what does that actually mean?
It means the molecules inside the tissue are forced to rapidly realign themselves with the shifting electrical field. Millions of molecules vibrating and rubbing against each other creates intense friction.
Oh, I see.
And that friction generates internal resistive heating.
So if the ablative laser is like aerating a lawn with physical holes, radiofrequency is like installing underfloor heating in your house.
Yes, exactly.
You are warming the entire structure from the inside out. And the devices usually hold that internal tissue temperature precisely between like 40 to 45 degrees Celsius.
Right, they have thermal sensors to keep it perfectly in that range. And sustaining that specific temperature range causes immediate structural contraction of the existing collagen. And it triggers long-term remodeling by those fibroblasts.
Like without the scabbing.
Exactly. All while leaving the delicate surface of the mucosa completely intact and unharmed.
Okay, knowing that, how does this radical difference in physics play out for the actual patient sitting in the clinic? Like, do they both work?
Well, the clinical data on both modalities is quite compelling. We can look at sources like a detailed retrospective study published in the journal MDPI.
That's the one that tracked the 91 women, right?
Yep, 91 women suffering from GSM. The researchers compared a cohort treated with a laser modality against a cohort treated with radiofrequency.
And the results.
Both scientific camps significantly improved the patient's vaginal health index scores. Both groups reported major improvements in sexual function, elasticity, and a reduction in severe dryness.
So medically, they both achieve the goal. But the physical experience of actually sitting in the chair for the procedure is night and day.
Completely night and day.
The RF treatments dominate when it comes to tolerability. Patients universally describe devices like Firmiva or the Form of E component of Empower RF as feeling like a warm internal massage.
Yeah, that's the phrase you see in all the brochures.
Because there is literally zero downtime. A patient can get the procedure done on a lunch break and resume normal physical and sexual activities that same afternoon.
Whereas the laser treatments, precisely because they are physically ablative, trigger a much faster initial biological response.
That's because of the trauma.
Right. You're inducing actual trauma, so the body reacts aggressively. But that comes with the cost of procedural discomfort, the need for anesthetics, and a mandatory recovery window.
And it seems like the RF camp is getting wildly ambitious with their engineering, too. Like the Empower RS platform, for example, it features a module called Morpheus 8V.
Oh, the microneedling one.
Yeah. They figured out how to combine the internal heating of radiofrequency with the physical trauma of microneedling. The device deploys tiny coated needles directly into the tissue and then fires the electrical current from the tips of the needles to push the energy deeper into the submucosal layers.
This is pretty incredible technology.
They even have attachments for electrical muscle stimulation to aggressively work the pelvic floor muscles for stress incontinence.
The sheer pace of that engineering is astonishing. But, when rapid technological advancement meets aggressive, borderline reckless marketing,
It acts like a beacon for regulatory authorities.
it absolutely does.
Which brings us to the inevitable backlash. Clinics were buying these $500,000 machines and boldly claiming on their websites that these devices could cure everything from urinary incontinence to orgasmic dysfunction.
All without surgery or hormones.
Right. So it was only a matter of time before global health regulators kicked down the door and demanded to see the receipts.
And when the regulators audited the landscape, they were deeply alarmed by what they found. We have to impartially look at the severe, coordinated actions taken by global health authorities.
What happened first?
Well, in 2018, the U.S. FDA issued sweeping, stern warnings directly to major device manufacturers regarding deceptive marketing practices.
And it wasn't just a slap on the wrist over vocabulary either. The FDA specifically warned that they were monitoring a disturbing rise in adverse event reports.
Real patient harm.
Yeah, patients were suffering from severe vaginal burns, permanent scarring, and persistent chronic pain directly resulting from these energy procedures.
And the medical establishment followed suit. Major governing bodies, including ACOG in the United States, the American College of Obstetricians and Gynecologists, and RANZINSOG, which governs Australia and New Zealand, released definitive clinical guidelines,
Stating what, exactly?
stating that these energy-based devices are not currently accepted surgical practices for treating these conditions. Their primary argument was a glaring lack of robust, long-term, randomized, placebo-controlled trials.
But the regulatory hammer really dropped recently.
Right.
In 2024, the Australian TGA, which is their regulatory equivalent of the FDA, went significantly further than just issuing a warning.
They took serious action.
Following an exhaustive post-market review, the TGA officially canceled the ARTG entries for vaginal rejuvenation for several major devices. They outright canceled the specific claims for devices like the Mona Lisa Touch and the U-Laser, and they legally forced other massive brands like InMode's Empower platform to completely scrub and withdraw their rejuvenation claims across Australia.
Just completely wiped off the books.
Now, I have to point out the massive contradiction here.
Okay, let's hear it.
We are looking at peer-reviewed journal articles, like that MDPI study showing women's vaginal health index scores jumping up significantly. We have gynecologists on record praising the life-changing results for breast cancer survivors who have literally no other options.
That's true.
So if the underlying physics of neocollagenesis makes sense and observational studies show it works, why are major regulators literally canceling the registrations for these devices?
That contradiction is the exact center of the current medical debate. You have to clearly separate clinical experimentation from the burden of regulatory approval.
Okay, break that down for me.
Doctors operating in private clinics are seeing genuine promise in using these devices off-label. In short-term observational studies, absolutely demonstrate symptom relief for GSM. But regulatory bodies like the TGA and FDA operate on a totally different evidentiary standard.
They need more than just observational promise.
Exactly. They require rigorous, multi-year safety data derived from massive, double-blind clinical trials. And the manufacturers of these devices, frankly, have not funded or provided that high level of exhaustive data to prove the long-term safety and efficacy of blasting vaginal tissue with lasers and electricity.
And it comes right back to that insidious marketing language we talked about at the beginning.
Exactly. Regulators vehemently oppose the term vaginal rejuvenation. They view it as a highly dangerous, deceptive, cosmetic buzzword that trivializes what is, in reality, a serious medical intervention on incredibly delicate mucosal tissue.
Because it makes it sound like a facial.
Right. When a clinic markets tissue ablation using the same breezy, relaxing language as a spa facial, they inherently downplay the very real risks of thermal burns, nerve damage, or scarring.
So what does this ultimately mean for you, the listener, trying to navigate this wild landscape? Let's bring this all together and answer our central question. Are branded rejuvenation procedures medically different from one another? The answer is a definitive yes.
The differences are profound. Choosing between a CO2 laser, an erbium laser, or a radiofrequency device means you are selecting entirely different mechanisms of physics.
You are choosing between photothermal ablation, which violently vaporizes tissue and demands downtime, and electromagnetic resistance, which gently heats the tissue from within using friction, requiring virtually no downtime.
But despite those very real, highly engineered scientific differences, the overarching umbrella term of rejuvenation remains a deeply contested marketing illusion.
It's a buzzword.
It is. It's a buzzword currently caught in a fierce, ongoing tug-of-war between enthusiastic doctors trying to offer non-hormonal relief to women with GSM and strict global watchdogs trying to protect vulnerable patients from unproven claims and permanent physical damage.
The fundamental science of utilizing directed energy to stimulate collagen production is endlessly fascinating, and it holds incredible medical potential. But right now, the aggressive marketing has vastly outpaced the long-term clinical data required to back it up.
And that's the reality consumers have to face.
Which leaves us with a final, provocative thought to ponder as we wrap up. If we are already using energy-based devices to fundamentally alter the structural integrity of human tissue without prescribing systemic hormones or making a single scalpel incision, what happens when this technology truly matures?
That's the big question.
Will we one day view energy hygiene like using localized radiofrequency or light to routinely maintain our body's collagen as we age and normally as we view going to the dentist for a 6-month teeth cleaning? Or will these harsh, continuing regulatory crackdowns push these powerful, non-surgical enhancements entirely underground?
We are watching a brand new frontier of medicine evolve and honestly stumble in real time.
Next time you see that glossy spa menu, you'll know exactly whether they are trying to sell you a precise blowtorch or a relaxing system of underfloor heating. Thanks for taking this deep dive with us. Keep questioning the science behind the marketing.